minute and to allow folks to enter into the meeting from the lobby. Thank you. Welcome. My name is Michelle Cunningham, Marketing Outreach Coordinator at Healthcare Workforce Development. We are excited that you have joined us today. Before we begin, I'd like to discuss a few housekeeping items. The webinar is being recorded. The chat option is open. We will entertain questions in the chat during the question and answer session, which is at the end of this webinar. In addition, during the Q&A, your mics will be enabled and you will be able to raise your hand to ask questions. I am thrilled to introduce our presenter for this afternoon, Clinton Ramstad, Program Officer with the Healthcare Workforce Development. Thank you, Clinton.
Thank you, Michelle. Hi, everyone. I'd like to thank you for joining us for our PCR webinar today. We're going to go over the updates we've made to our recent PCR application this year. Again, my name is Clinton Ramstad. I'm one of the program officers for the primary care residency program. What we're going to demonstrate today is our technical assistance guide, and it'll be posted to the Song Brown website for your reference. It would be a good idea to use this guide to supplement you while you're going through your application. So please refer to our website and take a look at it. All right. About Song Brown, we provide education for funding programs in primary care, family medicine, internal medicine, OBGYN, and pediatrics. We do family nurse practitioners and physician assistants, registered nurses, midwifery programs. That's one of our new programs. Song Brown also provides financial incentives for to graduate individuals who practice in medically underserved areas, enroll members of underrepresented groups in medicine to our program, locate the program's main training site in medically underserved areas, and operate main training sites at a majority where the patients are Medi-Cal recipients. As you all know, the application opened on June 30th, and our deadline is August 12th at 3 p.m. If you submit your application prior to July 29th, which is what we're calling our early submission review, okay, we'll provide you the opportunity for a pre-application review. In this process, a program officer will review your application and provide feedback. Once feedback is received, you will have 5 days to correct any errors on your application. If you submit after that date, say it's your first time and you're submitting after July 29th, you will not be eligible for this type of review. Only applicants who submit their applications by the early submission date will have their applications reviewed and be allowed to make corrections. Please keep in mind these items. Share our grant guide with your contract office if it's needed. HCI won't make any changes to your grant agreement language. We have a brand new program funding opportunity. If you know someone who's wanting to start a training program, please share this information with them. We need more programs to apply, and we're really excited about it. One of the things that's taking place here, we used to have our old program, okay? Our new, what we used to call new programs, and we used to offer $800,000. That's been bumped up to $1 million. So if you're very close to achieving ACGME accreditation, you have an opportunity to grab that money, but now it's been bumped up to $1 million to help you out. Also, too, we have our brand new program, our new programs with Match. The goal is to help programs who are starting off a little bit earlier in the process and have the longer road to go. They can capture up to $2 million of funding to help support them and develop them and get that money they need to get their program moving. Also, too, our new program application includes a new questions and changes to our scoring criteria. So be aware of that as a difference from what we've done last year. And feel free to email us if you still have additional questions. All right, some information you'll need to gather before starting on your application. You're going to need if you have a previous grant agreement, you might want to refer to that. You'll need your 204 information for your tax purposes. Like, in other words, what is your IRS coordinated name, organization name and address? We need to know that in order to get you coordinated for payments. We need to know what facility type you have. Is it prime? And we're particularly interested in folks who have continuity clinics. We would like to know your payer mix for each of those clinics. We would be interested also in data about the race and ethnicity of your residents, the high school information, where they came from, and but most important, please make sure that your organization name and information is correct. Okay. When you're going through your application, you please make sure that all your graduates are entered into the application properly. Also include your national provider identification number for each of those graduates. And also, if you have a ACGME letter, we would also like to see that too. And then also, if you have a current permission from your organization, we would also like to see that as well to apply for a new training program. If you're interested in starting a new program, okay, we would like to see your please gather up information for your 204 signatories, a payer mix information, correct organization name. Okay, see, documents required here. If you're applying for a new program's application, you may be required to provide documentation for each of the corresponding phases you have completed. Unlike in previous years, this process is a little bit different than we had before. This is the result of implementing our new program with Match. What we're looking for in this process here is that in order to distinguish you having a new program with Match versus a new program like we used in previous years, we have these phases and we've outlined them. If you're early in the process, okay, we're basically classifying you as phases A through C. Okay, if you look up there on the presentation here, if you're in the beginning of it, if you've done if you're in phase A, phase B, or phase C, you're potentially eligible for the new programs with Match. You're earlier in the process, you'd be eligible for that up to $2 million award. In that program, also being early in the process, we also want to make sure that you're going to stay with it and try and finish it, because we're catching you earlier in the process. In this one, we actually have a 25% match, which you'll be obligated to use your own funding and prove that you've used your own funding in order to grab the full award of the $2 million. If you happen to be later in the process, meaning that you're in either phases D, E, F, or G, you're going to look more like what we would call our new programs like we had in the past. The people who traditionally awarded $800,000, but now it's $1 million. And so the burden of proof is going to be a little bit less. You don't necessarily have to prove all those programs if you're starting in it. It's similar to what we did in the past in the classic application. But we will need to see your residency accreditation when you're ready, when it comes time to prove that. Okay, but you in this case, because you're further along in the process, that's where you're only eligible for the $1 million. This slide here shows the available Song Brown funding categories. As you can see, we still have our existing THC, expansion, and then of course our two new programs, new program and new program class with match. Excellent. Please keep in mind that if you're a new program, you can only apply for new program funding. We're not expecting you to go through and do a new program application and an existing one because you're a new program. So just please be aware of that in case you're wondering, like, you know, if you want to fill it, because we do allow for that in the other application forms. Excellent. This table shows the award categories, the overall dollars available for each category, the award amounts, and the disbursement method should you receive an award. That's all of our money available. Right here, this is some helpful resources. In this TA guide, you'll have the opportunity to click on it and go directly to the links in our website. So you can access our glossary in case you're seeing terms you're not familiar with. And then also our grant guide, which is extremely helpful. And our grant guide offers copies of our grant agreements in case you'd like to see and review that ahead of time as well. At this point in the presentation, we're going to skip ahead a little bit as everyone is largely familiar with setting up an EAP account already. If you have changes, if you've made some changes to your program or program directors, the training programs, organizations, address, we will need to know about that in order to help you, because that'll gum up your application as you're going through it. So if you happen to experience one of those situations, please tell us so we can help you out. At this time, we're going to skip ahead a few slides, all the way to roughly about slide 25. To starting the application here. All right, as you're going through the process, please select a training program. If it's not found, click on the training program not listed. Use the magnifying glass to locate where your training program name is. I would highly encourage you as you're going through this, because we've had several questions even since our last webinar this morning. A lot of people having trouble finding their training programs. Sometimes when they input their application, they may use a different name or change their name slightly different. But it's very important that you use the correct name that you used last year. The benefit of using the same name like last year is that it will import all your data correctly. So if you're not sure what your training program name is, you're welcome to send us an email. We will provide that to you. I know it sounds like a silly thing to say, but occasionally people will, their organization might switch the names or the representation of their names around. And so it's in alphabetical order. And so that might be confusing if you're thinking it's one name and you know you had some other word in front of it before the last time, but we can provide that to you. The benefit is that you won't get lost. Your information will be able to transfer and it'll be a big help to you. You will be prompted to enter your training program address at the top of the page. Your training program address may be the same as the information if you're holding your program at that facility. If your program will be held at another location, we would like you to input the address for that training program as well. We want to know where your residents actually work. Also, too, there have been a few exceptions where folks have put in their address and the system can't find it. We would ask that you go and check Google and see if you can refine the address to maybe see what Google has to say about it. If even Google can't find it, that address, and you can't match it up here, please reach out to us and we'll see what we could do to help you. The address matching, though, it requires that it has to know what address you're at, and if it can't match it up, then it'll result in an error and you'll be stuck. So we have to get this address issue resolved. The program information will also list the award categories to which you can apply. We still got the same format, the new, existing, THC, and expansion. When you go in the new, unlike last year, it'll launch you into another screen. It'll be a little different than it was before. And we'll ask you further questions, and then the other ones are pretty much the same as it was last year. So this shouldn't be too much trouble for anybody. All right, now we'll briefly go over the new programs and highlight some of the changes that we've made to them, and in contrasting the new programs versus new programs with match. Now, Phase A is absolutely mandatory. There's no way around that. If you haven't gotten as far as Phase A, and Phase A is proving your institutional affiliation or proving that you have applied for institutional affiliation. If you haven't even gotten that far in the process, then there's really nothing we could do to help you. We need you to at least be able to prove that to start in either application. These phases, like I said before, they're what determines what type of new program you'd be eligible for. Again, phases A, B, and C, they put you in the new programs with match, the $2 million ones, and D, E, F, and G move you into the application we used before, what was the $800,000 for people who just had a new program and were a little closer to achieving that ACGME accreditation. To determine your eligibility for the new programs, you will need to ask yourself the following questions. In this process of applying for, are you in this process of applying for, or have you already had a sponsoring, have you already had a sponsoring institution? You have not received any prior Song Brown funding, are in the process of completing or have completed phases A through C. Again, that puts you in the new program with match. If you have not yet completed phases D through G, also new program with match. If you are willing to match 25% of your own funds to against or with our total HCAR award. And again, we'll say if you say yes to A through C, you may apply for the new programs and match with funding. How the new program funding works again, if for example, you opt, sorry, let me change the slide. If you opt for the $2 million, you'll be required to make a 25% match, meaning that your stake in it is $250,000, or I'm sorry, $500,000. That's the money that you and your organization are going to have to offer outside of our funds to prove that you're, that you're serious about this, and proof that will be done later in the grant agreement process. See. Now, to determine your eligibility for the classic or for the regular new programs, what was traditionally the $800,000, we will know, of course, the phase A, we still need to know that you have your institutional affiliation and you're able to prove that. You have obtained your residency program accreditation, and you have no first-year students at the time of the application, and you have not received any other prior Song Brown funding. You've completed phases A through D, and if you said yes to A through D, you may apply for new programs funding. Now we're going to start the new program application process itself. To start the new program's application process, check the new program box. After completing the after completing that page, be sure to click Save and Next to move on to the next page. Also too, please keep in mind, when you're going through an application, you don't have to do it all at one time, not all in one sitting. Every time you hit that Save and Next, it's saving your application and you have the ability to come back and work on it at a later time. So please don't feel pressure to rush through it all at the same time. Next is the contract administration page, and that comes as the next part of the application. There's two very important notes. Your 204 address is your remit to address. And if you are at all uncertain of what your organization or your payment should be sent to, please consult with your contracting authority at your organization. Additionally, your contract organization must match what is reported to the IRS. Incorrect information on this page may cause a delay in your grant agreement or payments. We've also added a new section this year for a PO box, and that's a new 204 category. So this is a new and improved feature that we're offering. After that, we got our program data page. This is where you have the opportunity to go through and select your phases, okay? You review your accreditation phases all the way A through G and find out which ones that to determine how far along in the process you are, so we can route you to the correct application. Whenever you select yes to phases A through C, that means that you're willing to make that 25% match, and you're also eligible for the $2 million of funding. And it could be yes to A, yes to B, and then like that, or it could be yes, yes, yes. So there's a couple different configurations, but you're eligible for the money as long as you're saying yes inside of A, B, and C, and then no to everything beyond that. Now, when you say yes to anything above D, E, F, and G, or any combination thereof, okay, that makes you eligible for the $1 million worth of funding, or what we used to traditionally call the $800,000 of funding in past years. You will need to provide supporting documentation for every time you say yes. So when you're going through this page and saying yes, 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 down the line, you're going to have a document to prove that, and we will ask for that at the end of the application. There's a couple exceptions where where you actually input the data into the application and don't necessarily need to upload proof for it. There are two exceptions for that, but you'll see later on in the process when you go through the application. Please note, when you're getting to the part of the training sites, we don't want to see all of your training sites. It's a question we are commonly asked. We only want to see your continuity training sites. So whenever you're going through this application, only tell us about your continuity training sites. Adding extra sites is not necessarily going to help your score in any way, because it's tied to what is your continuity site. Scoring is tied to that, okay? When you're going through the process too of selecting your sites, I want to emphasize the importance of when you click that button to add a site and you're going through and writing in the information, there is a yes and no bottom at the application asking if you had a chance to review the application. If you say no to it, okay, it'll result in an error. If you say yes, it'll be okay, but please look at all the information. The purpose of that box is just to make absolutely sure that you have an extra chance to put your eyes on that and make sure your information is correct, because a continuity site will affect your score. So you want to make sure that that's absolutely correct. All right. Beyond that, okay, we offer you the opportunity to talk about what type of program it is. Like if it's a community health center, FQHC, you know, if you use our links, okay, you'll have our links will tell you what our system knows about it right off the bat, okay? Occasionally, there's people who will use our link, they will not find their location on there, and it may not say that they, it may not agree with the conclusion. We do a little extra work for checking, and to see if your program is available. So the links that we're providing there is a good resource to use, and we highly recommend you check it, okay? But if you think your program qualifies for something like a teaching health center or FQHC or something like that, keep in mind, we will do our due diligence, a little extra work and effort to see if we could prove that for you on your behalf. In case it's not being represented on those links that we're providing to you. A facility that won't qualify as one of these is a general acute hospital. So please be aware of that as well. Next, please enter the pair mix for the continuity training site you've entered. Everyone will likely have one or two, and please enter your pair mix as a whole number, not a percentage or any other combination of that. Also, the pair mix is tied to the site itself. We have seen some questions over the last few days where folks that want to do the aggregate of their whole program. We're interested in what's going on at that particular site itself. After entering your continuity training site information, you can edit or delete that information by using the options button on the right side of the page. Next, we have the executive summary and program strategies, which consist of one question and a series of strategies that we would like you to select. In the categories, when you're selecting them, you can do any combination of clicks you want, okay? They don't have to be in order. If you have one that applies and another doesn't, that's okay. Just click those categories based on your circumstance so we can evaluate your application. The executive summary is required and has to be answered before continuing on to the next page. And how you answer all of these questions will affect your score. The residency training section consists of a series of questions. After completing this page, save and proceed by clicking Next. You will enter how much funding you are requesting here. The maximum funding you could get for a new program, so what we did in the past, what was the 800,000 now, is been bumped up to $1 million. So if you're further along in the process, remember those phases we talked about, A, B, C, D, E, F, G, if you're closer to completing all those phases, like you're on, E, F, or G, for example, that's all you can ask for is $1 million. You can't ask for more than that. The same applies if you're earlier in the process and you're looking for money. The maximum that we're offering for the new programs with match is $2 million for the folks earlier in the process, okay? You cannot ask for more than that at this time. The new programs with match will populate an additional budget table, okay? Provide your anticipated or actual expenses related to each budget category listed, and separate your costs into their respective phases. You must put in a $0 amount for the remaining used fields. This comment box is only utilized when you have identified an expense that falls into the category of other. If you're going through the process and you're doing the new programs, what was traditionally the $800,000 before, you will not see this, okay? This is for new programs with match. At the moment, we're having an issue with our print view, and we're getting that fixed right now. For the folks who are in what was the 800,000 new program from previous years, if you were to print view at this moment in time, you would end up seeing this box, but please don't be alarmed. We're getting that fixed right now. Next is the patient demographics. Please note these percentages for all of these categories. They cannot exceed 100%. And if you have boxes that you didn't answer, you're going to have, sadly, you're going to have to enter in a 0 for any category you didn't address. And all of it has to add up to 100%. Next is the required documents. Earlier, we talked about the phases in the process. Phases A, B, C, D, E, F, G. You'll see that earlier in the presentation. You'll see that on the application as you're going along. Every time you said yes to a phase, okay, that's moving you here later in the process where you're actually going to have to upload a corresponding box, a corresponding document for every time you said yes to one of those questions. So when you see the red highlight, that means that there's an action that's required from you. It'll say 1 file required. You need to go upload that, okay? Anything that's green, you're okay. It'll say 0 files required. Also too, in this process, I know some other programs have more sophisticated upload technology. We need you to put in a prefix for it. And I'm sorry to have to do that to you. But anyway, we offer instructions of what the prefix will have to say. So if you could just add that to your document when you're uploading it, the system can recognize it and accept it and move on to the next part. And then you'll be okay. Now, once you've uploaded all the required documents, the buttons will all be green all the way across the board, signifying that you can continue. Please take into consideration that sometimes our uploading may also take a little bit longer than you may like. It's improved since last year, but it is taking still a little bit longer than we would prefer. So if you see a little delay, please don't get alarmed. It doesn't necessarily mean anything's wrong. It just takes a little while. Next, we have our assurances page. This needs to be checked before you submit your application. Please read the language carefully and click agree to submit your application. Now that that's been done, your new program application will have been complete and submitted, and you'll see this screen. To view or print your application, click the down arrow button on the right side. You'll have the ability to print the application in sections. The graduate, resident, and the training program information will be on a separate print option. If you happen to be in that category of a new program and you're looking for the $1 million, the print feature is currently reflecting an application like a new program with match. That's being fixed. It'll be resolved in just a couple business days, hopefully. So if you see that, please don't be alarmed. All right, now we're going to go back to the old school and we're going to talk about our PCR existing teaching health center and expansion slots. A lot of aspects of this application have not changed since the last year, but today we're going to address the things that have changed. Next, each funding category listed provides eligibility criteria. Click each funding category you qualify for. And remember, you can have more than one. Select your training program here. If it's not been found, click on the training program not listed. Use the magnifying glass to locate your training program name. The existing expansion and THC applicants most likely have applied in the past and should already have a training program name. And remember, if you're having problems finding your name, please reach out to us. We'll be happy to help you. We do not want to get people bogged down and having problems with their resident and graduate data transferring over. We'll be happy to help you. The next few slides are similar to the new program contract administration page. We will briefly go over them again in case you missed hearing that information. Ensure that all the information is accurate and the correct signatories are listed. Note, please verify that this information with your finance or contract officer to ensure that the information is correct. Providing incorrect information will delay your grant agreement should you be awarded. Provide program data on graduates and residents. Depending on your selection, additional questions may appear. For example, click resident and graduate data, and you will have to provide information for both. If you don't have graduates yet, you'll click resident data only. You will have the option to import your previous application data into your new application. You will need to continue to use your previous program training name to utilize this feature. As mentioned before, use the magnifying glass to search for your training program name. If you have to type in your name, this will not work. The import feature may not work for you if you did not apply last year either. When I add to that also in saying that we've had a few folks that applied 2 years ago and missed last year, and they've also had some trouble applying. If you are in that situation too, where you missed a year, we'll take a look at it and see if we can help you with that. But that may be, if you didn't apply last year, that may be one of the reasons why your application data were not awarded last year. That may be one of the reasons why your application data is not being pulled forward. All of your resident and graduate and continuity training site information should transfer over if everything is working correctly. Your second and third year data should import over from the previous applications, and you should have to, every time, you should have to enter in your first year residents. So first year being new, that will not transfer over. Yes, fresh information, you still have to enter that in. We've had questions about that as well. Let's see, if your training sites this year, only if you're importing your training sites this year, only your continuity clinics will come over. In the past, we allowed for people to write in all their training sites. But if you had old training sites in there before, if you did not designate them as a continuity clinic, they will not transfer over, and that's on purpose. We want to suppress that. So if it happens to be one of those sites has changed or the status has changed, you'll just have to input that new. Let's see. Imported data transfers to the errors automatically, and you'll be required to check each one in order to clear it and move forward. So want to re-emphasize this point again. When you're transferring your data in, all your training sites will appear as an error. That's not that anything is necessarily wrong. We want you to lay eyes on it, double check it, and make sure it's correct. If everything looks fine, then you can just clear the error and move on. Okay. We just wanted everybody double check to make sure, because it's a different year, something might have changed. Again, we're only looking for the continuity training sites. Don't give us anything else, please. Next, select the facility type that best applies to your continuity training site. If your continuity training site doesn't fall under any of these category or facility types, please mark not applicable. Now, provide the payer mix for each continuity training site you enter. Again, you are only providing your continuity clinics. Payer mix information is required for your main primary continuity clinic. When you get to the point of entering in your taxpayer information, that does not need to equal 100%. We've had questions about that before. That could be any combination of, we're asking you what it is. Does not need to equal 100%. Once you've reviewed your training site, please click the yes button that you've reviewed it, and then please move forward. Now, after you've entered in your continuity training site information, you can edit or delete the information by using the options button on the right side of the page. This application has an executive summary along with a program description. You will enter in your executive summary and program description into these 2 pages. Depending on your funding category you choose, be prepared to provide additional information. Your annual expenses can be higher than what you're requesting. However, they cannot be lower. Please fill out all of the fields that we're asking for. If you're applying for THC funding, you need to fill out a budget summary. If you aren't requesting funding for a budget category listed, please input 0. If importing resident data, please ensure that all resident data has successfully transferred over. You can view previous year's resident data in EAP under the Applications tab. Imported data transfers to the errors list when you will be required to go and check each individual record to clear it and remove it and go forward with it. Add additional residents here if it's needed, where the arrow is. Once you click Add a Resident, a window will pop up. Please fill out all the required fields. After completing this page, click the Submit button. Once completed, you can add more residents. In addition, you can edit or delete the information that you've input. If importing graduate data, please ensure that all of the graduate data has successfully transferred over. You could view previous year's graduate data in EAP under the Applications tab. Imported data transfers to the errors list. Then you will be required to check each individual record to clear it and then move forward. Here, you will add additional graduates if needed. Once you click Add a Graduate, a window will pop up. Keep in mind that the amount of graduates input needs to match the amount of graduates on the program data page. Graduate practice site data should always be the most current practice site data. We want to know where they were working at each day they work. All right, on the graduate data page, selecting yes to the question, do you know the graduate's practice site, will prompt further questions. A facility type list will populate. Select the facility type that applies to the practice site. If the site doesn't fall under any of these facility types, please mark not applicable. Click the Add a Graduate button each time you want to add a graduate. You can also edit or delete graduate information from this page. Here are some common mistakes. Please review these carefully. Applicants do not provide correct contract organization name. Applicants do not provide the correct grantee and 204 signatories. Applicant added a training site and did not search for a previously used training program. I'm sorry, you added a training program but did not search for a previously used training program. Applicant did not enter any data for residents or graduates, even though the applicant has residents and graduates. Applicants enter practice site names and addresses for out-of-state graduates. The information is only needed for graduates who are practicing in the state of California. You can attach documents pertaining to the accreditation approval and applicable expansion approval right here, where the arrow showing. Once you upload all the required documents, the buttons will turn green, signifying that you may continue. Click Save and Next to continue. Now we have the assurances page, and they need to be checked. This needs to be checked before you end up submitting your application. Once you click Submit your application, it'll be complete. You'll be complete. To view the information submitted or print out the information, click on the down arrow button. You have the ability to print the application, but in sections. The graduate, resident, and training program information will be on a separate print option. And please remember that we're resolving the new program application print view. So if you happen to be in that situation, we know about it and we're working on it, and we apologize for that. All right, lastly, do you guys have questions?
Thank you, Clinton. I see that there are many questions in the chat, and we will get to them. You also may raise the hand icon for questions too. You will find the hand icon on the top of the screen with the reactions button. I will call on you. Your mic will be enabled and you will need to unmute yourself. To unmute yourself, the mic button is at the top of the screen. And then after you're speaking, please mute yourself and lower your hand icon. Feel free to continue to place questions in the chat. We will do our best to answer all your questions in the time provided. Side note is that this webinar recording will be posted on our website on the Song Brown page. Thank you. I'm going to look at our chat and take the first question from Ira. How can we get a copy of the slide deck presented today? I'll go ahead and answer that. The slide deck is already on the Song Brown page underneath resources available right now. Thank you. I'm going to go for another one in the chat from Becca. Hello, the PDF printout of our partially completed application does not show all the sections and questions and has the wrong dates. We cannot get past the resident screen to see what the remaining questions are, as we are still gathering data. Do you have a complete, accurate printout of all the application questions?
Oh, okay. Well, I'll do my best with that question there. The print view, as we stated before in the presentation, you're only allowed to print certain sections of it at a time. We can't give you all of it at once. In terms of I don't have an explanation for the date issue because this is a new concept for me. But in terms of if there's an issue with the resident information being incorrect or whatever, you're certainly welcome to reach out to us. We can grab the list for you, bottle up in an email and send it back to you. If you need to double check any of that information. But we really don't have a way of providing or being able to give you the ability to print the entire application or all the application questions at once. It has to be done section by section. Does that answer the question?
I'll check in chat because she provided the question in chat, and I'll follow up more. Thank you, Clinton. Hand raised is Dolores. Please unmute yourself.
You already had answered the previous question. It's the same. Where can we locate the power slides?
Okay, it's on. It also is on the Song Brown website. We have our glossary there, the grant guide. We have this presentation. Wonderful resource to use. So please, check us out.
Thank you.
Thank you. I'm going to go back to the chat and I apologize for mispronouncing your name, Sarisa. Does HCI need program to put in addresses for graduates who are out of state or country?
Okay. A graduate who's out of I don't know. I'll probably have to take that up with the managers because I don't know. We discussed that a long time ago, and that's why the website doesn't allow for the opportunity to input that. At the moment,
I can address that.
Oh, this is Melissa. This is our
Hi,
supervising
everyone.
manager.
This is Melissa. I'm the Song Brown Program Manager. So if you have a graduate who is not working in the state of California, whether that's in another state or out of country, we don't want you to provide us any information about other than the graduate's name. When you click into that page, there is a drop down and it says that they're either, you have two choices. You don't know where they're working at, or they're not working, I think, in the state of California. So you choose one of those, and that's the only information that we need.
Melissa, just to follow up, if I understood the question too, I think they were interested in about the address for where they graduated from.
The address where they graduated from. So
Yeah.
they're talking about a resident. So
No,
they want,
I'm sorry?
I can read the question again.
please.
Does HCI need program to put in addresses for graduates who are out of state or country?
Right. So no, we do not need you to put in an address. We need you to reply either unknown or out of state. I think it's out of state or unknown. Those are your only two choices for people that are not working in the state of California. So even if you know where they're at, you know they're working at a clinic in Texas, but we don't take that into consideration. We are only interested in where they are working at in the state of California.
Thank you, Melissa.
Thank
Sure.
you, Melissa. And hand raised, Mano, please unmute yourself.
Thank you. I have a quick question regarding one of the earlier slides that Clinton went through. And I saw something about permission for application, submitting a document for permission for application. What would that document be? I know about the ACGME accreditation letter, but what kind of document will you be looking for that we have permission to apply for the grant?
That was the institutional affiliation. I realize that we said permission on the slide, but that's what we were looking for. Basically proof that your sponsoring institution is okay with you pursuing this process.
No,
Okay.
no. Any.
As far as proof, we need you to either have your letter from the ACGME saying that you have institutional accreditation or proof of some sort that you have applied. So say you've submitted your application and you get some type of email back saying, we've received your application for institutional affiliation. I don't know how they do it. We'll accept that as well.
Okay, so basically the ACGME accreditation letter for both the program and the institution will suffice?
Yes, I think so.
Okay, perfect. Thank you.
Thank you. Question in the chat from Banush. What if the new graduates from 2022 do not have a job yet? What do we put in the application field?
I think that's something that we're going to have to look into because honestly, we've never had that problem. I don't know if you're certainly not able to put nothing in the field and move forward. So we'll need to check into that and get back to you. We don't have a drop down where you have the option to put in not working yet or anything like that. We're assuming that most of these people have a position somewhere. So I don't know honestly how you would respond to that.
Thank you, Melissa. Celia in the chat. Should we include data on new interns that came in June of this year?
Yes, so we asked for all of your current residents. So If you have residents that started 6:30 or 7:1, yes, they would be included in that information.
Already answered Ken's question about the recording of this presentation. It will be available on our website. Celia, can the grant agreement signatory and SDD 204 signatory be the same person?
Absolutely.
Teresa, can you tell me why our 2022 graduates are not on our application?
Why are the 2022 graduates not on that?
Can I ask a question? Did you apply last year?
Yes.
Then this may feed into the problem that some of the other programs are having, the issue that we're checking into.
Okay. Can I ask the second part of the question I have for that?
Sure.
None of our resident data populates in there, so we can download the Excel spreadsheet, but there's no way to upload that back into the system or add any residents. I see no place to do that on the application.
This is why I asked if you applied previously, because we no longer use that upload feature like that.
Okay. So how do I individually add that information? Because there's no button to do so anywhere on our side.
Can you let us check it for you and make sure that you did apply last year and you would have data to carry over? And then we can get back to you.
Sure. I know I applied, but yes, you can for sure.
Okay, thank you.
Thank you.
Well, if you could send us an email with your application from last year, that would be helpful too. Or at least the application number, sorry.
Okay, thank you.
Thank you. Jonathan, what is the maximum funding for existing programs?
Oh, 625,000.
There you go, Ben.
Or are you asking?
No, you good.
Oh.
Are
Are you asking the question? Or?
No.
Oh, it was another Jonathan.
Sorry about that.
Give me Jonathan's.
Go ahead, Clinton. He's the next.
The 625,000, sorry.
Okay, thank you. We are coming up at time. I see that Melissa, program manager, has gone ahead and answered some questions in the chat. I want to take a look. Dolores, your hand is raised. Do you have another question?
No.
Okay, I'm just scrolling through to make sure we answered all the questions in the chat. Teresa, how are we able to upload resident data? The resident data Excel report generates, but it does not add it to the application and it does not allow us to add the information.
That's the same question as before. Upload feature is disabled this year.
Okay, and Michelle, okay. We have a graduate who isn't working currently. It's new, weird times.
Not working? Okay, yeah. Well, we also got that question in just a minute ago, and frankly, this is new territory for us because usually everybody wants doctors, and so we don't know what to say. We'll get together, figure out something to come up with a policy to tackle that one, but at the moment, we're not sure what to do. It's a new concept.
Sorry about that.
It's new weird times for us as well.
Yes,
Honestly,
hello.
we've never ever had that question before.
Got it. And the new weird times. I believe all the questions in the chat have been answered. If not, please go ahead and email the address on the screen and we will respond to you after the webinar. And Clinton, let's take it from here.
Well, folks, thank you so much for participating and listening to us, or listening to me ramble on here. If you have other questions, don't forget, use our email. We'll try to help you the best we can. Also too, if you have a question related to a specific grant agreement or application, please give us the grant agreement or application number. Sometimes we get emails where somebody's like Hi, I have a question about something and we don't know who they are or where they come from or what they're looking for, so if you could just provide us a little bit of that backup, we greatly appreciate it in researching your question and trying to help you. Outside of that, thank you so much for your time. We really appreciate it and we want to do our best to try and help you out. Hope
Thank
everybody has
you.
a great day.
Thank you.
Thank you.